Hi, my name is Maurice Lee. I work for the Cabinet for Health and Family Services out of the state of Kentucky, and I'm going to be doing my action research project on the relative fictive kin population and how long it's been taking us in the state of Kentucky to license and certify our foster families, and doing a project kind of looking at that and understanding the why I chose this project. So just a little bit about myself. I've been in child welfare for now about 10 years. I have worked in the field, or worked with direct service with our families for about 4 years. And then eventually I made my way to a policy position within central office, which now I'm a relative service array specialist. So I deal with everything that it relates to our relative and fictive kin population. So you'll see an overview of my presentation. So we're going to get to know why I chose this topic and why I'm passionate about it. Some little bit of background information to better understand my why and exactly what my PICO is and the intervention and methodology in which we went through to address the issues that we found during the case reviews, my evaluation, and what we're going to do now. So first, we're going to look at a little bit of disproportionality data for Kentucky. So this is back in 2021. So when you look at this chart, you're going to see that one reflects anything greater than one represents representation in our foster care system. The one thing I really want everyone to pay attention to is the more than one race, because it doesn't specify necessarily which race of individuals we're talking about here. But it's important to note that more than one race is starting to become a trend in the state of Kentucky. Kentucky is really unique with this population. It is majority Caucasian, and you have pockets of diversity throughout the state, with Jefferson County, or known as Louisville, as having our probably highest representation of diversity and the highest African-American population. But when looking at this graph, when you look at in foster care, we see that African-Americans slightly overrepresented kids in foster care. But when you look at more than one race, that's where we see the more significant disproportionality. So please keep that in mind for a future slide. So a little bit about my project and the data that I initially had that led me to want to dig a little bit more deeper. Currently in Kentucky, it's taken 9.4 months to certify a relative and fictive kin foster home. That's significant because our policy strictly states that we should be licensing foster homes within 4 months. Also, 5% of children there's only 5% of children that are actually placed in relative fictive kin foster homes. This is a low number that we want to see increase. So while we know that the Anti-Education Foundation has estimated that there's around 59,000 children in some form of kinship care in the state of Kentucky, what we need to make note of is that this is more so informal placements. So Kentucky has actually one of the highest number of kinship placements in the nation, and we're ranked currently at 6th. So my topic and my reason why. So the time that it's taken for our relative fictive kin to become certified as foster homes, that's 9.4 months is too long. And the reason why that's important is currently in Kentucky, we offer the families what we call the relative service array. And what this does is whenever a child has entered the child welfare system and it's no longer safe for them to remain in the home, we obviously reach out to our relative fictive kin caregivers first. And so we give them the option of either taking relative temporary custody or the option to become a foster parent for that child. And so what happens is that family receives a per diem, a lower per diem than our foster care maintenance payment while they're in the approval process. But this allows for that child to still remain in that home with their relative fictive kin caregiver until they are fully approved. And because they're in that process, we pay them that amount. So the time that it takes, 9.4 months for them to be approved, that inhibits that family from receiving that full per diem amount. Also, we know across the country, we are dealing with high acuity youth and difficult to place kids. It's important that we're having a kin first mentality with that. because we know that kin are more likely to help and want to be more supportive and not necessarily disrupt a lot of these kids versus placing a child in a traditional foster home. They're willing to stick it out with a lot of our kids that have a lot of trauma. And also, in one of the more important aspects of it is our guardianship assistance program. Here in Kentucky, we're going to call it our subsidized permanent custody program. And so we're one of the few states that doesn't necessarily have this program. And so we're looking at how we can better support this population and not let this addition of this program be a barrier, because we know with guardianship assistance, in order for a family or a child to qualify, they would have had to receive the foster care maintenance payment for 6 consecutive months. And if it's taken 9.4 months for our children to be in homes that are actually a certified foster home, we have to add an additional 6 months to that before that child would then be eligible for guardianship assistance. And we don't want that to be a reason why we're holding up timeliness to permanency for those kids. So with that, I developed a PICO, and it reads as such: if we work to reduce barriers to become certified as a foster parent for our relative fictive kin caregivers, while we are working on implementing a new permanency options for these families, we will see improvements in timeliness to permanency while being able to provide additional supports to our relative fictive kin population. So a little bit about the literature review. We know historically that African Americans were originally excluded from the child welfare system, but now we are currently overrepresented. And so we think about the strengths of the African American community over the history. Literature says legal adoption is not as good a fit with African Americans as are the policies of kinship care and legal guardianship that draw on the strengths of African American families and communities. So when we think about history, it was always that grandmother, that grandfather, and uncle that if that parent could not be there, they would automatically step in the role of supporting that child. And they would always leave the door open for whenever that parent would return in order to continue that, so that way that child could still have that ties with their mother. So we see that guardianship is a better fit for the African American communities. And we also know children have better outcomes. They have better overall outcomes of safety, well-being, and permanency when they spend more time with family while in out-of-home care. So it's really important that we, in Kentucky, kind of have a more kin-first outlook when it comes to placing kids whenever kids aren't able to return to their home safely or be placed with their parents due to some safety concerns. So this is what I did to try to attempt to see what some of our barriers were. I took a look at 74 individual children, which included 41 home studies and 41 different investigations for each of those home studies. And from that, we developed a case review capturing various dates, and milestones important to the certification process. These dates were to help us understand how long it's taken the family to get from point A to point B to point C to point D. So that way maybe we can pinpoint where some of our barriers were. And these homes were all relative fictive kin foster homes that had been approved between the time period of December the 1st of 2022 through February 28th of 2023. So when looking at the findings of these case reviews, with 41 of those cases reviews, we found that no homes were approved within 120 days or 4 months from the point that the child entered into out-of-home care. 31% of those families attended the information meeting within 30 days. So the information meeting is the meeting that every parent, every foster parent, or every individual that's seeking to become a foster parent, they have to attend that informational meeting. So only 31% of our relative fictive kin families actually attended that meeting within 30 days. And then time child entered care to family attending an informational meeting, it took on average 2.5 months for that family to attend that informational meeting. Also, some findings, there was no accountability from tracking from when the home study is completed to when it's informally approved. So at that point, when the social worker has completed that home study, there's no way to formally track how long that case study or that how long that home study sits there before it's actually formally approved. And whenever you talk with supervisors about it, on average, it's found that 14 days should be the average length that it should take for a supervisor to review and approve that home study. Of those 41 cases that were reviewed, only 20% were approved in 14 days. And then on average, it took 51 days for approval of those home studies. Once it took 51 days from the point of which the worker completed the home study, and then a supervisor reviewed and approved that home study. So a lot of times in child welfare, we think about going for the big win, but sometimes we need to think about going for the smaller wins, things that we can have some instant control over that may add up to big wins. So when we look at the number of homes that were approved within time frame, we see here that it was 0 homes. And then when we look at 10 homes, between 121 days to 183 days, 10 homes were approved. So you look at 21 homes, it's 184 days to 364 days. So that's a little less than a year. And then a year more, it was 10 homes it took a year more for them to be approved. So when we look at this data and we do just a little bit of simple math, which with social workers, sometimes we struggle with math. But if we get families to our informational meetings 45 days sooner, and we approve home studies within 14 days of completion, rather than having a 0% timely approval rate, we could have seen 34% of those cases actually approved timely. So taking small steps along the way to meet certain deadlines that are listed in our policy, we could have saw a 34% timely approval rate versus 0. So also some incidental findings. So whenever you're doing work, sometimes you come across those things that catch your eye. Well, this is one of the things that actually caught my eye. So income. On all of our home studies, we list income. And so whenever I was doing these reviews, I noticed the homes that had a higher income, or it appeared as though the homes that had a higher income, it looked as though that they were getting approved quicker than those who had lower income. And so I actually had to go back and go through all those home studies again and pull all their income out. And you can see that if your home was approved 4 to 6 months, the average income of those homes was $96,290.20. If it was 6 to 12 months, it was $78,071.10. And if it was a year or longer, your average income was $32,170.10. So that's something to really think about. Is it that we're pushing our families that have more means to get through, or is it just those families have the means to get through the approval process quicker? So that's something for us as an agency to think about, but the numbers tell the story that those who have more income are for sure getting approved a lot faster than those with lower income. Another incidental finding was the biracial race. So I want you to think back to the graph at the very beginning of my presentation where it talked about more than one race of kids that were in out-of-home care was at a higher disproportionality rate than those that were of one race or even African American. So when you look at this graph depicts the likelihood that you're going to be reported on and then have some type of finding in the child welfare system. So you can see that these two races are identified as African American and Caucasian. So when you look at this, the African American and Caucasians are twice as likely to be reported on. They're twice as likely to have a services needed finding, and they're twice as likely to have substantiation. So while we know historically we've seen African American population dwindle or the disproportionality rates reduce over the past few years, I think the things that we need to be watching for now is two races and what that really looks like. We can see when it's just African American in general, the services needed finding is below actually the threshold of being a disproportionality, and then substantiation is just a little bit above. So this is something that us as a state and really as a nation, we should be watching on how are we treating our families or our children that are of two races. So when you look at some of the literature around some of my incidental findings, well, first, some other things that I was noticed when going through the case reviews, that no home study was created equal. Our state is divided into 9 regions, and the 9 regions are ran by 9 different individuals who run the region in which best fits that region needs, and sometimes that leads to case studies not being the same across the state, and so that at times is problematic. When you look at health outcomes, this was really important. Health outcomes were closely connected to with the parental race and raised on a continuum. So when you think about, when we go back to what I found in my literature about biracial children in care, there's also been studies on healthcare outcomes based upon that. So children in household with 2 white parents tended to have the best health outcome. Those in a single race black household had the worst health rates. Household with white fathers and black mothers had rates closer to single race white household, and then those with black fathers and white mothers were closer to single race black households. So that's something important to hold on to and think about. So my intervention, so what I decided to do was to do a training for our investigative staff on engaging our relative fictive kin families and the importance of following the policies that we have in place in order to get families certified quicker. And then explaining findings of the case review, the negative effects of not meeting those timelines. And then because of that, I developed a flow chart to help walk our direct service individuals that provide services to our clients, to our families, the ability to be able to have something to read on hand to help them walk themselves through the process, as well as walk our families through the process. So you can see that this flow chart shows the steps that it takes to become a foster parent versus the steps of a relative receiving relative temporary custody. So it's important, like if you remember at the beginning of the presentation, I noted that families have 2 options. They either have the option to become a foster parent or they can take relative temporary custody. So this flow chart breaks down the steps that are taken by the worker in conjunction with the family, so that way the worker and the family can have an understanding of knowing what's coming next. And so whenever you get to the 7th and 8th steps, there's a 7th A, B, C that is specifically for our foster parents, with the final step being 8. It links back up together. So when you look at the temporary custody, there's also a relative temporary custody side to this. And so it breaks down the steps that are specific for families that decide to take relative temporary custody, and then all ending back up at the final step 8. So the results from the training, I had 9 participants. There were 7 social workers, 2 supervisors. There was 8 Caucasian, 8 female, and then 6 had 10 plus years of experience in child welfare system. And so what I did is I did a pre-post survey of understanding. So understanding of the relative service array 2 options. So 4 individuals had a good understanding or a high understanding, but afterwards it was 8. What caregivers are eligible for, before it was 3, now it's 8. Awareness of trends occurring in certification process. Before it was 3, and now it was up to 7. Importance of tracking cases for families seeking certification. So previously it was 5, and now it's up to 7. Items required for families to be approved, in the process for families to be approved of foster home. Both before where 4 of them had a lower understanding, but now 6 of them have a higher understanding of that. So I actually received some suggestions, and one suggestion was to change some language within the flowchart, which I did before this presentation. 6 of the non-participants indicated the flowchart was the most helpful, useful part of the training. And then as a result of training, attendees attended to utilize flowchart as a guide. So that's really important and really helpful information to know that this is something that they found useful to be able to take with them, that's easily accessible to help walk themselves and families through this process. Some additional comments: sharing data with regions is needed. So, we do things based upon evidence. So having the data out there for them is really important. And then the important to get this information out to our direct service folks, so that way that they can see the work that they're doing and how it actually affects families and why it's important for them to make sure that they're keeping track of all these various timelines. So challenges and limitations. So findings were based on raw data. So a lot of the information that I pulled from these case reviews are not currently being tracked. So this would require staff to be directly assigned to doing in-depth case reviews on this particular area in order to be able to see a real change or a real outcome. There's no accountability of fidelity monitoring. So i.e., from the time the home study is completed to formally approved, there's currently no way in our system for that to be tracked. And then not all home studies were created equal. So what now as an agency? We can adopt a different certification standards for relative and fictive kin families. So we know that the Children's Bureaus have recently released a rule change allowing relative and fictive kin families to adopt their own, for states to adopt their own certification process for those families. So I know as an agency, we plan on doing that to help reduce some of the barriers that some of our families will face. Look at strategies for fidelity monitoring. How can we start to track some of these barriers, specifically the time that a home study is with a supervisor, to see if we can work on tracking that to hopefully put some emphasis on ensuring that those are approved timely. And then ways to track when all paperwork is submitted to better understand other barriers to approval. So evaluation strategy. So monitor data to see if timeliness to approval improves in the county that was trained, and then improvements noted. Work with service regions to retrain our investigative staff, so that way they can have a better understanding of why it's important that they're following policy, and the reason, and to show them the negative effects of when they don't, and why it's important, especially with the hopefully implementation of our guardianship assistance program. So MPLD impact. So one of the things that I definitely learned throughout this process is perseverance, and then patience. We have to be patient, and then also learn to regroup. Regroup, I think, was a huge thing, especially for me, because while I was doing this project, I was also relaying a lot of this information to our service regions, because we are actively working to implement our guardianship assistance program. And a lot of these barriers will hurt our implementation to our guardianship assistance program, and learning to, whenever we present information to them and providing feedback to them, and then getting their input, and them not necessarily liking our ideas on what we can do to fix it, learning to go back, regroup, pull from the feedback that they gave us to try to have those small wins, so that way hopefully those small wins will add up to big gains. And lastly, increased gray hairs in my beard. I went home for Thanksgiving, so I'm born and raised in North Carolina, and so my parents are back home and I live in Kentucky. And so one of the first things that my dad said whenever he saw me over the Thanksgiving break was, "Boy, you got some gray hairs in your beard now." And also a dedicated prayer life to get through the last 3 months of this program. But overall, this program has taught me a lot. It has taught me to work well, even better, with collaborating with other individuals, and also just being a better listener. So this program has helped me tremendously in honing in on some of my leadership skills, and also having the ability to be able to speak up in those particular rooms, because now I know how to go out, find the data, and explain that data to be able to portray what it is that I'm trying to portray. Here are my references for my presentations, and I hope you enjoyed this presentation, and I hope you have a wonderful rest of your day.